Good afternoon, everybody, and thank you for joining today's deep dive into how to prioritise health and safety during office reopenings. We're going to be exploring how you can leverage air quality data alongside occupancy data to create a safe working environment for employees to return to as occupancy starts to increase as we return to the offices. My name is David Thomas, and I'll be your host for today. So unfortunately, you lot are stuck here with me for the next 15 minutes or so. The reason that open sensors are talking about indoor air quality is that it's become a very topical subject in the workplace in general. And open sensors work with organizations across all industries around the world, helping them to develop their workplace or evolve their workplace by really diving down into how teams are interacting with spaces, different assets, and using occupancy and workplace data to enable people to make evidence-based decisions in their planning and their transformation projects. What we've seen over the last 2 years is a real shift in perspective of how people can keep people safe in indoor settings. Originally, a lot of it was to do with social distancing and track and trace, and obviously they're still relevant, but from an organizational perspective, they rely very heavily on individual behavior, which can't really be accounted for all the time. But when you look at indoor air quality, it's very much something that you can take a top-down approach to in ensuring that the spaces that you're providing are safe and well equipped to bring people back into. Angela Merkel herself said she thinks that increased or well, looking after indoor air quality is the cheapest and most effective way of combating the spread of a virus in an indoor setting. That's why we're putting this on, and I hope you find today's session useful. To start off with, I'm just going to quickly take you through what it is we'll be discussing. So I'll start off by kind of saying what it is we mean when we talk about the environment and indoor air quality and how this impacts our health and viral transmission. I'm then going to look a little bit at what factors actually impact this air quality, and that'll largely be a deep look at the relationship between occupancy levels and the environment. We're then going to take another step and look at how you can then start to identify the trends between the two and the information that you can arm yourself with to affect change within your workplace, be it spreading occupancy out throughout the week, throughout your spaces more evenly, or arming yourself with the information to go and change your ventilation to make sure that more fresh air is being provided to your employees. There will be a little bit of exploration of the further benefits of prioritizing indoor air quality, but like I said, the main focus is definitely going to be the health and safety aspect. So let's get going. What you can see on the screen in front of you now are what I like to call the three pillars of the environment and indoor air quality. On the far left, we have the importance of fresh air in indoor settings. Simply put, fresh air minimizes the risk of inhaling COVID attached to airborne particles. So it's just making sure that you have enough fresh air to reduce the risk of contracting a virus. The second way the environment can impact our health and safety is by actually boosting our immune response. There are certain environmental factors which enable our body to fight off a virus the best way it can. And similarly, or conversely, I should say, there's the ways that environment can minimize viral survivability, so reduce the time that it can actually hang about and survive in the air and then be breathed in by one of us. Before we move on to looking at the benchmarks and the data itself, I just wanted to quickly touch on another reason why indoor air quality is important, and it's to do with our actual ability to function, our productivity and cognitive ability. And what we've found over and over again in different studies is that poor air quality negatively impacts our ability to think and our ability to make decisions. Chess players were 25% more likely to make an unforced error in a match when the air quality was really poor. And when you start to think about your workforce and your employees sitting in the same office, and you spend all this money on hiring the best talent, and you have them there to do a job, and you spend all this money on your workplace, giving them the right tools, the right spaces, making sure that they have everything they need to do their job to the best of their abilities, it seems almost silly to hamstring them with poor air quality. And I'm sure everyone here will have been sat in a tiny little meeting room with no windows at 4 p.m. and just be struggling to keep your eyes open. And the likelihood is you might be tired, but it'll just be the CO2 buildup causing you to be drowsiness, gives you headaches, that kind of thing. So as well as keeping us safe from COVID, indoor air quality can actually help us do our jobs better and be more productive in the office, which is obviously a great expense to most organizations. So if we go back to our three pillars, we can see that when it comes to immune response and viral survivability, what we need to be looking at is temperature and relative humidity. A temperature of 21 degrees C and relative humidity of 40 to 60% is the sweet spot for our immune system to work at its best, but also to make sure that the virus isn't thriving in our environment. But what we're going to be looking at mostly today is fresh air and the importance of fresh air in indoor settings. And when we're talking about fresh air, we need to be looking at CO2 as the benchmark data point. And this is because as you breathe in, you take oxygen out of the air and you expel CO2, carbon dioxide, back into the air. So when you're talking about a confined space, as people breathe, over time, the balance of the air will change. CO2 levels will rise, and that is really indicative of stale air that's being recycled between people, and therefore they're breathing in the same air, and it just increases the chance of COVID transmitting between these individuals. So we need to be looking at keeping CO2 safely between 300 to 500 parts per million. And it's when you start to see CO2 creeping over the 1,000 parts per million level that you really need to be worrying about either your occupancy being too high or your ventilation systems just not doing enough to get that fresh air into your workplace. So next up, we're going to have a look at the relationship between occupancy on air quality and what actually makes this air quality drop. So the two graphs here are showing a week period from a client of ours in London back in November 21. And you can see immediately there is a very strong pattern between the two. When occupancy is high, CO2 is higher. When occupancy is very low, CO2, like on the weekend, CO2 is nice and stable, doesn't peak, doesn't change. So it's the occupancy that is driving this change in CO2. And what's interesting is that, as you can see on the days throughout the week, occupancy doesn't change much throughout the day, but CO2 levels creep up throughout the entire day until they hit quite dangerous levels of 1,200 parts per million at times. And what's happening here is ventilation systems are struggling to replace the air that people are breathing. So CO2 is increasing throughout the day until the air is stale and it needs to be replaced. So that's the relationship we have between occupancy and air quality. Let's now look at what we can do to mitigate this and keep that CO2 level nice and flat throughout the week. The first thing we can do is use occupancy data to redistribute how people interact with spaces. And as you saw in the graph on the previous slide, occupancy tends to fluctuate throughout the week, with Monday and Friday being a bit emptier, Tuesday, Wednesday, Thursday being when people like to come into the office. So what we can do with this information is try and think, right, what can we do to flatten occupancy throughout the week? Stop it bunching up in the middle and try to lower it so that even if there are fluctuations in the day of CO2, they're not as drastic and they don't get anywhere near as high. Secondly, what we can do is look at the actual spaces within our office, not just the overall occupancy, but where are people going? Where's busy? Where's empty? How can we get people to go to that floor that's a bit further away, or that annex that's a bit around the corner? How do we make people spread themselves out so that the air they're breathing doesn't get recycled between people quite so quickly and those CO2 levels rise? Similarly, you can start to look at which assets people are kind of flocking to. Are people going to the collaboration areas? Are they going to the sit-stand desks? Are there areas of condensed occupancy continuously throughout the day that maybe you should be providing more of so that people can spread themselves out throughout them? And finally, occupancy data can be used on a departmental basis to see, is this department in the office all the time, quite close together, and could they do with more space? And which departments are behaving differently and potentially have some space that we could steal some seats from to spread this department out a bit more. But now we're getting on to the really important part, which is providing fresh air to employees. The key thing that you need to look at on this slide is in the top left-hand corner. And it's when we talk about 10 litres of air per person per second. That is what ventilation systems and HVAC systems are recommended to be providing per employee per second. Obviously, it's going to change from office to office. It's going to change based on the size of your office, how many people are in your office, how tall your ceilings are, that kind of thing. It's all very much on a case-by-case basis, but there are steps you can take using occupancy data to work out exactly how your ventilation system should be working to hit that number. So the first formula on the right, on the top there, is how to work out how many air changes per hour per person are required in your office to keep your CO2 at that nice 300 to 500 parts per million level. And once you've worked this out using your occupancy density and ceiling height, you can then take that air changes per hour figure and work out how much air needs to be supplied through your HVAC system into the space to hit that air changes per hour. And you do that by looking at the air changes per hour and the actual volume of your space. So your floor plan, square footage or square meterage times the height of the height of the room. And once you've got this information, you're able to then arm yourself with that. You can say to your building manager or to your landlord, or if you own your own space, to your facilities team, look, this is what our ventilation system needs to be doing. Currently, we can see that it's not. And that's what happened with the example I showed you earlier. That client wasn't aware that they had a CO2 problem until we put those sensors in. And they then were able to go to their building manager and say, even when our occupancy is at like 60%, our CO2 levels are 1,000 plus. This is not hitting any standards that we want to be, nor is it hitting things like the well building standard. So it gives you the information to go and challenge people to make the change that you need to be seeing, even if there's something that you're not directly in control of. So hopefully now you've got a good understanding of why indoor air quality matters, the relationships that it has with occupancy, and how you can kind of mitigate these factors to get that CO2 level nice and safe. So what we're going to do now is look very quickly at how you can actually start to gather that data, the steps you can take to make sure that you're covering all the right points. And what we do is we use environmental sensors, which monitor CO2, temperature, and humidity. So right there off the bat, you're hitting the three main pillars of indoor air quality in one sensor. And this is battery powered, it sits on a wall, you put it about 4 feet above the ground, or roughly head height when someone is sitting. You kind of want to concentrate on where people are most of the time. When you're in an office, it tends to be that you're sitting down at your desk. So you're going to want to put these in condensed desk areas, in meeting rooms with no windows, but also areas like cafeterias, kitchens, or thoroughfares where there's lots of people coming in and out. That's where you tend to find very high CO2 levels. And then this data is transferred to our dashboard, which is where the analytics get done, and those graphs that you saw earlier are generated. So I want to give you a bit of information on how you actually would get started with this kind of project, because the sensors themselves are at the very, very beginning of these projects. And we work with people who have a consideration or a challenge that they're struggling to do without data. So we take a step back, we analyze their space, we analyze their challenges, and we deploy the correct array of sensors, a combination of space sensors and environmental sensors to get the necessary data. This data is then transmitted from these sensors via LoRaWAN protocol to our own gateway system, which runs completely separate from your Wi-Fi. So it's its own entity. You don't need to worry about infringement or anything. And one of the most common things we get asked is this all GDPR compliant? Does it correspond to the EEC? Yes, it does. It's only metadata being transported about, is this desk in use? Is this meeting room in use? It's nothing identifiable. There's no personal data in there at all. So this data is then sorted by our analytics engine, where we can then start to work alongside our clients to really understand, is the challenge that you came to us with what's actually happening in the workplace, and what changes can we make, kind of bring it to fruition? If we're talking about CO2 levels, it would be what spaces can we put people in to bring that level down? What can we do in terms of ventilation to get that CO2 level down again? And then it's a very iterative scientific methodology of just small change, gauge the result, work together to kind of make sure that we're hitting that end result, fully lining it up to your long-term business goals for your workplace. So that's the end of today's presentation. I hope that you've got a good understanding of why indoor air quality matters, and how to go about actually gathering it and making changes. We offer free consultations to do with this. So if you want to know more about how it could fit into your actual workplace, my information is on the screen. Please do drop me an email or come to our website. There's a plethora of information on there regarding this and further aspects of keeping your workplace safe and how to make sure that people are coming back in a controlled and monitored manner. So thank you all again for your time, and I hope you have a good afternoon.